We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you very much, Mr. Speaker. My question is for the Premier. On March 23rd, when I asked the Premier about funding for organizations that offer sexual violence counselling, he said, and I quote, his government is working with shelters across the province to continue to make sure we make those investments to ensure that people feel safe, and I will table that. Well, Mr. Speaker, unfortunately today people in Cape Breton must feel a little less safe. The Cape Breton Transition House Association announced yesterday that it is ending its sexual violence outreach program because of funding cuts from this government. Will the Premier admit that his government's decision to cut funding for a sexual violence outreach program in Cape Breton is short-sighted, a move that makes women actually less safe?
The Honourable Premier.
Thank you, Mr. Speaker. Thank the Honourable Member for the question. What she's referring to, Mr. Speaker, is 2 years ago there was a program put together. There was money allotted that all the organizations knew that funding was coming to an end. What I also said on the date she raised in the House that there is actually funding in this current budget that hopefully we'll get a chance to pass in the not too distant future, that we will be reaching out to our different organizations on how we best use that money to meet the outcomes that the organizations have been working on.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. It sounds like the Premier saying, though, that it's not needed. The funding ended. And really, there is no organization, though, on Cape Breton Island that got funding to provide specialized trauma therapy for victims of sexual assault. Victims and survivors of sexual assault must travel now to Antigonish to get the services they need and deserve. And this sounds very familiar because we all know, Mr. Speaker, that young people in Cape Breton also who need and deserve mental health services must travel 5 hours to the IWK to get those services. So, will the Premier explain why his government decided that sexual assault victims in Cape Breton don't need specialized trauma therapy close to home?
The Honourable Premier.
Thank you, Mr. Speaker. I did not at all say, Mr. Speaker, that that funding was not required, Mr. Speaker. What I have said, that the program that was in place was a program that had an ending to it. Fact of the matter is that program is being assessed, and as I said to the Honourable Member on many occasions, we have actual funding in this particular budget that we will reach out to our organizations and partners to give best practices and the best way to make sure we support those Nova Scotians who require that support, the best way to spend that money.
The Honourable Leader of the Official Opposition on her final supplementary.
Well, Mr. Speaker, in a media story, the Executive Director of Cape Breton Transition House was confused about the reasons the sexual assault trauma therapy program had been discontinued by this government. She said her organization actually exceeded all of the expectations for the program. She felt she was being assessed under the 2 years of receiving funding. There is definitely a need for this kind of therapy, and the program was meeting all expectations. Mr. Speaker, we can't blame her for being puzzled by this government's decision to remove funding. So will the Premier explain why funding for the sexual assault therapy program in Cape Breton was discontinued by his government and not left there to make sure that women and children feel safe?
The Honourable Premier.
Mr. Speaker, again, I want to thank the Honourable Member for the question, Mr. Speaker. That she would know, Mr. Speaker, the House when the program was announced, there was an end date to that particular program. The funding has not been cut, Mr. Speaker. The funding is actually in the current budget. What we have said is we're reaching out with our partners to make sure that the right programs are in place to support those Nova Scotia required, and we look forward, Mr. Speaker, to having our budget passed and going out and continuing to work with our partners.
The Honourable Leader of the New Democratic Party.
Thank you. Yesterday, the Premier suggested that minimum wage workers in Ontario are losing hours because of the recent minimum wage increase. When asked by journalists to name the source of this information, the Premier said he had the data to prove that low-income Nova Scotians lose purchasing power when the minimum wage goes up. Mr. Speaker, if this is so, then there are a good many reputable, credible economists who have just been refuted. So it's reasonable to ask the Premier if there is such data to please table it and make it publicly available so it can be subjected to the scrutiny that it calls for.
The Honourable Premier.
Thank you, Mr. Speaker. I'll be happy to do so.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, may I have your permission for 30 seconds to review the document that's just been tabled?
Does the member have a question?
Okay. Yes, I do. Secondly, may I ask the clerk for the title of this document?
The Honourable Premier.
Thank you, Mr. Speaker. The reality, Mr. Speaker, is we continue to know the best thing that we can do for all Canadians, Mr. Speaker, and Nova Scotia, is to continue to get our fiscal house in order, to continue to grow the economy of this province, to continue to provide hope for young people in this province, Mr. Speaker. The honourable member asked me for, it's called the impacts of minimum wage increases on the Canadian economy. It's done by the Bank of Canada.
The Honourable Leader of the New Democratic Party on his final supplementary.
Thank you, Mr. Speaker. I'm familiar with this study. It is a study from December 2017. That is a month before the minimum wage increased in Ontario. The numbers that I am referring to from Statistics Canada are numbers which have been calculated since the minimum wage increased. And those numbers show not only that the number of jobs has increased since January 1st increase, but that the total number of hours in those jobs has increased. So the Premier, surely, if he is going to stake the position of our government on a study, can find a study that looks at the change that's happened since it's happened and not makes a prediction about what it thinks is going to happen before it. So I want to ask the Premier, will he then acknowledge that there are a good many credible economists who find his position on this subject without merit?
The Honourable Premier.
Mr. Speaker, I want to assure the honourable member, Mr. Speaker, there are lots of Nova Scotians who have disagreed with positions I've taken over a period of time, Mr. Speaker. The fact of the matter is, every time I make a decision, Mr. Speaker, our government makes one, we go and defend it to the people of Nova Scotia. We communicate it out to them. That's why, Mr. Speaker, they're continuing to work with us to grow the economy of this province, to provide new opportunities, why we're seeing investments, Mr. Speaker, in research and development, export growth taking off, Mr. Speaker. We're seeing more young people who are staying, and we've changed the trend that was growing under their government, Mr. Speaker, where more young people saw hope and a future in this province, in good-paying jobs. It's why we've invested, Mr. Speaker, in pre-primary, because every child, regardless of the socioeconomic circumstances they're born into, should be given an opportunity to grow in this province. We're going to continue to work with them, Mr. Speaker. We're going to continue to put out good public policy, and we're going to continue to make sure this province is moving forward.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. They say necessity is the mother of invention, and that was definitely the case in Chester. When an adequate and accessible health care was not actually available, members of the community banded together and opened a new walk-in clinic. That was accomplished actually by a not-for-profit organization with almost no involvement from the Nova Scotia Health Authority. Will the Premier admit that the Health Authority is ineffective when a group of volunteers can provide primary care for a community where the Health Authority could not?
The Honourable Premier.
Mr. Speaker, I want to thank all of those community organizations across the province who work with our health organizations. Without the foundation and auxiliaries, Mr. Speaker, a good number of things that happen in our community facilities, our healthcare facilities, would not be taking place, quite frankly. I want to thank them. I want to thank the people of Chester and all those Nova Scotians who continue to go out to make sure that we invest and help support the critical infrastructure that our communities require.
The Honourable Leader of the Official Opposition.
I think what it shows is just how ineffective the Health Authority is. The Mayor of Kentville is actually quite intrigued by this new walk-in clinic in Chester, and her community has a critical doctor shortage, as many of us know. She believes community-run clinics are the way of possibly moving forward in the future, but she maintains the province should actually be responsible for the recruiting of doctors, staffing the doctors, and staffing the clinics with administrators, etc. So my question is, why is it that the Nova Scotia Health Authority, the Premier and his government, continues to download healthcare services on community organizations and municipalities, Mr. Speaker?
The Honourable Premier.
Mr. Speaker, the honourable member would know, Mr. Speaker, that health foundations have been supporting infrastructure across the province, Mr. Speaker, for as long as, Mr. Speaker, I've been in this House. Mr. Speaker, under all three parties, they've been working with the infrastructure. I do want to, though, acknowledge, Mr. Speaker, that the walk-in clinics play a role in delivering clinic, but I do not believe, Mr. Speaker, they replace what we are looking at in collaborative care. Doctors, healthcare providers actually will tell you the challenges around a walk-in clinic is they do not have that face-to-face personal relationship with their patient to make sure that they can follow their health year after year after year. It's why in the most recent changes we're investing more in those healthcare providers who are working in clinics, Mr. Speaker, because it allows those patients to be attached to a healthcare team over the long period.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. My question is for the Minister of Environment. The minister's decision to approve burning tires at the Lafarge cement factory is based on laboratory experiments done at Dalhousie University. And in budget assessments this week, I questioned the minister's decision, and he responded that the approval is just for a pilot project, and that once the pilot was concluded, the research that had been done will be confirmed or not. Well, that surprised me, Mr. Speaker, because I didn't realize the minister's decision to do this was based on a science experiment that he was doing. I would have hoped that the research would have already been thoroughly confirmed before we start burning tires, not after. So my question for the minister is this: does he concur that the Department of Environment should not be in the business of turning Nova Scotians into guinea pigs while experimenting with our environment?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I thank the member for the question. As the member knows, a pilot project is just that. It's a pilot project based on the evidence that we have in the application. It's approved for the environmental assessment. It still has to go through the process for industrial approval. This practice does take place in other jurisdictions throughout the world and also in other provinces. We have the evidence from Dalhousie and Dr. Gibson and the team. We look forward to the results. Thank you, Mr. Speaker.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Well, please forgive me, Mr. Speaker, but that does not make me feel much better, and I'm sure most Nova Scotians listening to that would make them extremely concerned. The minister has said that his decision to allow the Lafarge cement plant to burn tires was based on scientific facts, but there are serious doubts that the minister had all the facts in front of him when he made that decision. The recent court case that came out upholding the minister's decision was actually decided on just a technical point of law. It made no judgment about whether it was a good decision for the environment. And a respected toxicologist, Dr. Doug Hallett, has strongly stated that the minister did not have all of the information necessary to make an informed decision. I will table that. So given Dr. Hallett's warning, I would expect the minister to realize he should revisit his decision and ensure it is the right one. So my question for the minister is this: is he comfortable knowing that there is now more information available, more scientific facts available? Is he comfortable allowing tire burning to move forward based on a legal technicality when people's health and our environment are at stake?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. I'm very comfortable with the process we have. We have environmental assessment that includes a 30-day period for public submissions. We took in all the submissions and we had our staff review all the information that was before us. As I said, this practice does take place in multiple jurisdictions with very strict air quality standards, including states like California, including provinces like British Columbia and Quebec. This is approval for an environmental assessment, and we're pleased with the court's decision on that file. Thank you.
The Honourable Member for Pictou East.
Thank you, Mr. Speaker. Mr. Speaker, yesterday in public accounts, the Auditor General highlighted the failure of the Department of Health and the Health Authority to release regular short-term performance metrics for surgery wait times. This is something that the department and all the health authorities had initially agreed to. In fact, at the time, the health authorities seemed particularly eager, promising that regular performance targets would be up and running no later than March 2015. Flash forward 3 years, Mr. Speaker, and we still don't have those regular public targets indicating what kind of progress they're making. All the AG got on follow-up was some vague assurance that targets are being set and will be monitored. So my question for the Minister of Health is, does the Minister plan to hold his own department and the Nova Scotia Health Authority accountable for missing this self-imposed deadline by 3 years and counting?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I thank the member for the question. Mr. Speaker, as is the case when recommendations come forward from the Auditor General, they get reviewed and assessed for the ability to move forward on them, Mr. Speaker. We continue in those cases where the recommendation has been accepted to work towards them, either through the department or our partners at the health authorities. The member in his question noted that the statement he made reference to was in March of 2015. The member would recognize that the legislation in place that created the Nova Scotia Health Authority took place in April of 2015. Mr. Speaker, the recommendations were not for the entire province, some jurisdictions or regions and health authorities. So, Mr. Speaker, part of the process of moving forward on these recommendations does include standardizing throughout the province, which was not considered at the time those commitments were made.
The honourable member for Pictou East.
Thank you, Mr. Speaker. And the minister may well be right, but they had some evidence right in front of them of what standardizing would mean, what appropriate standardization would be, and that was informing the public of how we're going as to meeting the wait lines. If my children went all the way through school and I was only to find out on graduation day that they weren't fit to graduate, I'd be a little disappointed. That might be okay with the minister or the health authority, but the public is being told that operating room efficiencies, that an operating room efficiencies group, quote unquote, has this well in hand. But there's no evidence that it's well in hand, Mr. Speaker. We have a target date of 2020 to meet the national benchmark on surgery wait lists, but there's no quarterly reporting as to how we're going to meet that benchmark. We have an Auditor General who says interim reporting should be happening. Health Authority says it should be happening, but it's not happening. My question for the minister is, will the minister finally stand up to the Health Authority and tell them that saying, trust us, we got this, is not good enough?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and I thank the member for finally acknowledging that I'm right. Mr. Speaker, with respect to the metrics, Mr. Speaker, I've already made reference, Mr. Speaker, to past questions in this legislature through estimates debate, that in fact in October we acknowledged and reviewed and released a plan for moving forward, improve particularly our orthopedic surgeries, Mr. Speaker. We made a commitment to work towards improving. We already announced, Mr. Speaker, over 400 additional orthopedic surgeries conducted since October and the end of March. Mr. Speaker, we've invested more money following that plan that's in place, and we expect to have an additional 350 surgeries going forward in this fiscal year.
The honourable member for Inverness.
Mr. Speaker, a question for the minister responsible for the NSLC. The sale of cannabis in NSLC stores will require a source of supply and a secure distribution network, a huge undertaking to be completed in a short time here in Nova Scotia. As legalization rolls across Canada simultaneously, there are only guesses as to what the national and provincial consumption levels will be, and no certainty that suppliers will be able to meet that demand. Other provinces have already secured their suppliers. When will the minister tell Nova Scotians that a reliable source of supply for cannabis has been secured and a secure distribution network has been established?
The Honourable Minister of Justice.
Thank you, Mr. Speaker. It's my understanding as we speak that the Nova Scotia Liquor Corporation has in fact issued an expression of interest. They have reached out to all of the producers, those outside of the province as well, and they're quite satisfied and comfortable that they will have the source they require to meet the needs.
The Honourable Member for Inverness.
Mr. Speaker, we have heard the Minister of Justice say in this legislature that legalization will make it safer for youth. Mr. Speaker, I don't believe that to be the case, and I'll tell you why. We know that 50% of marijuana is going to be sold online. It's going to be delivered by Canada Post. With all of this marijuana flowing through the mail, will it really matter if people are ordering pot through the NSLC or from illegal markets? No one is going to know the difference, and there are no measures in place to stop illegal marijuana shipments from reaching underage youth through the mail.
The Honourable Minister of Justice.
Thank you, Mr. Speaker. I certainly respect the opinion of my colleague, but must disagree with the position that he's advanced. My colleague would know, Mr. Speaker, that a medicinal marijuana stream administered by Health Canada has been in place since the early 2000s. There is a mechanism that confirms identity for purposes of delivery and receipt. The same circumstances, Mr. Speaker, will apply to this recreational stream that will be legalized, Mr. Speaker, sometime this summer, but I want to assure my colleague, you have the option of an unknown illicit product, or you have the option of a regulated, controlled, analyzed product for the general public to consume if they choose to do so, Mr. Speaker. But the most important piece of this legislation, Mr. Speaker, is in fact to protect the safety of Nova Scotians, particularly our youth.
Hear, hear. The Honourable House Leader for the Official Opposition.
Thank you much, Mr. Speaker. Nova Scotians remain concerned about the government's use of private email servers to conduct public business. A recent report confirmed the member formerly responsible for the Department of Health and Wellness used a series of private email accounts for correspondence instead of the government's email server. Now, whether intentional or not, the use of private email for government raises serious questions of a possible breach of privacy. A spokesman for the Department of Internal Services stated that the type of email account used does not factor into whether a privacy breach occurred, and as such, there's no indication of a breach. And I'll table that document. So my question to the Minister of Internal Services, can she explain the specific analysis undertaken that confirmed email sent on a private non-government server was not subject to a privacy breach?
The Honourable Minister of Internal Services.
Thank you, Mr. Speaker, and I'd like to thank the member for the question because it is a very important issue that he brings up. To reiterate what the position of our department is within the FOIPOP Act, it is not the medium that is used, but the content. So it is at the utmost of importance for all public servants and elected officials that any government business that is conducted be done in a manner that is subject to FOIPOP. But the medium, whether it's a government email or a Gmail account or whatever the case may be, is irrelevant. So further to the member's question, I actually would like to table the protocols and forms used for conducting a privacy breach.
The Honourable House Leader for the Official Opposition.
Next one. There we go. Thank you very much, Mr. Speaker. And I appreciate the discussion with the minister. As I know, we're probably not going to get a chance to talk about her budget and her department in the Red Room later on today. But as we know, government policy governs the use of email by minister and stipulates that it must be conducted using official servers and channels. In this particular instance, the member felt that no confidential information had been exchanged on private servers and that he was told to and change his email practices after they were raised. However, I'd like to have some comfort that this is not a larger issue within government. So could the Minister of Internal Services please tell the House how many other cabinet ministers were found to be using private email servers and confirm the specific steps were taken to educate the members of the government about the proper email protocols?
The Honourable Minister of Internal Services.
So again, I'd like to thank the member for the question, Mr. Speaker, and I would like to reiterate that the medium that is used to conduct government business is not an issue. It is the content. So anything, any government content, whether it's an email or a conversation, anything that is about government business is subject to FOIPOP. So whether it's done from a private email or a public email, it makes no difference whatsoever. The same policies are followed, and I will table our privacy policy for the member as well.
The Honourable Member for Cape Breton Centre.
Thank you, Mr. Speaker. Mr. Speaker, with 500 people in their community still on the waiting list for a family doctor, the Our Health Centre Association in Chester has opened a walk-in clinic staffed by doctors willing to come in from the city to work a shift or two, and I'll table that. This walk-in clinic is in addition to their existing family practice, which people in Chester built through extensive fundraising. According to Thelma Costello, chairwoman of the association, the community was fed up with inaction and couldn't wait any longer for the health authority to provide a solution. Mr. Speaker, the people in Chester built their clinic from the ground up and still aren't getting the help they need from the province. Does the Minister of Health think this situation reflects well on his leadership?
The Honourable Minister of Health.
Thank you, Mr. Speaker. As the member would well know, the work that's ongoing between the Department of Health, our partners within the health authorities, and even partners, Doctors Nova Scotia, Mr. Speaker, with the nurses and other healthcare practitioners, that the efforts, Mr. Speaker, to improve the access to primary care services for Nova Scotians in Chester, Cape Breton, and throughout the province, Mr. Speaker, is well underway. We had the opportunity to announce earlier in March an expansion, an update on our expansion of collaborative care practice, Mr. Speaker. It's well underway. We're seeing a lot of enthusiasm, Mr. Speaker, over 100 responses to Nova Scotia Health Authority's expression of interest for physicians and healthcare providers interested in expanding or creating new collaborative practice. Mr. Speaker, the plan and the priorities in place, the plan is in place, and the Health Authority is well underway in execution.
The honourable member for Cape Breton Centre.
Mr. Speaker, the group in Chester has piqued the interest of other communities. Kentful Mayor Sandra Snow says the only way to cut through the red tape presented by the Centralized Health Authority is to ensure that decisions about healthcare services are made at the local level. However, at the same time, she worries about allowing the province to abdicate responsibility for ensuring that communities get the health services they need. Mr. Speaker, does the Minister of Health agree that our publicly funded healthcare system to work, investments need to reflect the actual needs of the communities, not the abstract ideas that are dreamed up in Halifax?
The Honourable Minister of Health.
Thank you, Mr. Speaker. I believe all members of this legislature, reflecting the interests of our constituents, do agree that one of the top healthcare priorities is access to primary care, Mr. Speaker. We recognize that. We've made it very clear through the campaign and forming government that that was a top priority for us. That's why we continue to invest, Mr. Speaker. It's why we continue to work with the collaborative care practices based upon the feedback and input, not of individuals just in Halifax, Mr. Speaker, but from across the province. We hear from physicians and healthcare providers in professions such as nursing and physiotherapy and other allied health professionals that indeed working as teams is not some far-flung idea, Mr. Speaker, but rather an important transition in our healthcare system. It's one that we're pursuing, and it's going to improve primary care access for Nova Scotians.
The honourable member for Cole Harbour Eastern Passage.
Thank you, Mr. Speaker. My question is for the Minister of Health. One of the symptoms of a sick healthcare system is excessively long wait times. Like most other members of the House, I spent the long Easter weekend with my extended family. I have a relative who has a large abdominal hernia, and she has been told she will have to wait over a year to have her surgery. Mr. Speaker, she is in her 80s. Can the minister tell me what he has done to reduce the wait times in specialties other than orthopedics, please?
The Honourable Minister of Health.
Thank you, Mr. Speaker. The work that is ongoing to improve efficiencies in the operations, we rolled out first the orthopedic work, Mr. Speaker. This was a plan that was designed by the frontline officials to help identify ways to be more efficient in the delivery of the surgeries. That learning, Mr. Speaker, is something that we look at then to see how it can be applied in other areas of specialty. So again, we start with orthopedics. It has the longest wait times, Mr. Speaker, with most people waiting, so that's why that was the first area that we targeted, but we certainly learned from those experiences and look forward to seeing enhancements rolled out in other areas of healthcare as well.
The honourable member for Cole Harbour Eastern Passage.
Well, given that only 44% of the Auditor General's recommendations for the Nova Scotia Health Authority in the orthopedic area were completed, I don't have a whole lot of confidence that an area that hasn't been looked at by the Auditor General is going to fare any better. My supplementary question to the Minister of Health is, at the same family gathering, I learned that 2 of my family members were charged $10 by their family doctors to have their prescriptions renewed. One of them was a call-in over the phone, so they called in, the doctor called into the pharmacy and they charged the family member $10. I've learned that that's not standard across HRM or around the province, so I'm not sure why one person's getting charged $10 and the other one isn't. However, the other family member was in the doctor's office and still got charged the $10 for the prescription renewal. So my question to the minister, can you explain to me why a family doctor would be double charging both the government as well as the patient to fill one prescription? Thank you.
The Honourable Minister of Health.
Thank you, Mr. Speaker. If the member would bring specific case forward, I haven't heard of that practice taking place, but as the member would know, those physicians that work in those practices are independent practitioners, Mr. Speaker, if they've made the decisions to bill in a particular way. What I want to let the member know, though, is that in fact there is a Canada Health Act that the physicians would be expected providing insured services, that they should not be double billing, Mr. Speaker. So if the member or other members are aware of that, I'd be pleased is bringing to my attention, certainly investigate that. But also, Mr. Speaker, I'd like to remind the member that with respect to phone-in and other means of providing services, we recently announced an agreement with Doctors Nova Scotia to enhance those opportunities, providing a flat rate billing to physicians, family physicians, Mr. Speaker, to ensure that that type of practice does not occur.
The honourable member for Colchester, Musquodoboit Valley.
Thank you, Mr. Speaker. The first part of my question is for the Minister of Justice. Yesterday, the CBC reported about the high number of tickets for aggressive driving issued in the Stewiacke area. In the last 2 years, officers issued 553 tickets in the Stewiacke area. There were 2 fatalities or serious collisions in the area as well. One resulted in the death of Kyle, the son of Daryl and Charlene Davis. And now the government is adding additional risks and temptations to young drivers with the introduction of cannabis. So my question is, will the minister take action to help prevent such tragedies like this in the future?
The Honourable Minister of Justice.
Thank you. Thank you, Mr. Speaker, and I want to thank my colleague for the question. I think this is a very relevant question that points to some of the challenges that we face, Mr. Speaker, in the legalization of recreational cannabis. One of those elements of the provincial piece of legislation that I introduced earlier this week is specific to driving offences, Mr. Speaker, and quite pleased to say we worked very close with MAD Canada. MAD Canada had identified some gaps in what they believe was happening across the country. In our discussions with them, we were able to identify those elements and ensure that they were part of the bill going forward. And I'm quite confident that the measures we've included, the authority that we've given, the further and expanded authority that we've given the law enforcement community, Mr. Speaker, we will in fact be able to enhance road safety.
The honourable member for Colchester, Musquodoboit Valley.
The second part of my question I'd like to address to the Minister of TIR. Road tragedies are all too common in Nova Scotia on the roads, and stories like the Davises are certainly heartbreaking. And first responders live with the memories of witnessing far too many young people being hurt or killed. 452 of those tickets were issued in the Stewiacke area alone. And I must admit I was one of them. I wasn't paying attention coming out of an 80 and into a 50. But stop talking, I know. I'm asking, will the minister review the speed limits in the area of Trunk 2 and Main Street, along with the possibility of adding a 4-way stop at that intersection?
The Honourable Minister of Transportation.
Thank you, Mr. Speaker, and I want to assure the House and all the folks in Nova Scotia that highway safety is our #1 priority when we go to execute our duties under the highway legislation. Because of traffic patterns that do change, we're constantly monitoring to see what kinds of changes would be suitable. And in this instance, we'll certainly take a look at what situation is there and see if there's any recommendations from our department. Thank you.
The honourable member for Victoria the Lakes.
Thank you, Mr. Speaker. My question through you is to the Minister of TIR. Mr. Speaker, last December, the Englishtown Ferry was supposed to be closed to all traffic until April of this year to allow for reconstruction on the ramps and other items. And we know now that the timeline has changed. Residents in the community are concerned that the ferry connecting tourists to the Cabot Trail may not be operating until later into the tourist season. This is not good news for businesses along the north shore of the Cabot Trail because many tourists are anxious to get to their destination and don't stop to check out local businesses along the way. So my question is, what assurances can the Minister provide to residents that the new completion date of May 30th for Englishtown Ferry will be met?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I'm so pleased that our government has decided to do a complete overhaul of that very important link that will enhance the safety of the ferry, and also to upgrade the facilities, particularly the the washroom facilities that are included in that particular area. As the member would appreciate, and all folks in the area, it's pretty hard to hold back the strength of the pack ice that comes into that area there, and that got a hold of some of the cribbing that was involved in that area, and it was no match for Mother Nature. So that's changed the water on the beans a bit, and has resulted in the time for completion being pushed back a bit.
The honourable member for Victoria the Lakes.
Mr. Speaker, there are flashing lights indicating that the ferry is not operating, but not all travellers pay attention to them, especially tourists. Many tourists rely on their GPS to get to their destination. However, their GPS won't tell them that the ferry is closed because in reality, Englishtown Road is still open for local traffic. Unfortunately, for a tourist who continues to travel down this road, they'll have to turn back, often causing stress and strain because they aren't familiar with the area. So my question to the Minister is, will the Minister commit to adding additional signage advising motorists to use exit 11 as an alternate route, and that detour signs as well as local traffic-only signs are installed to eliminate any confusion tourists might encounter?
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker. And as the member would appreciate, that particular part of Nova Scotia has fond memories for me. I spent much time on the ferry and various travels between Antigonish and Ingonish. And one of the most delightful parts of that travel is the opportunity to visit Tarbert Vale, Mr. Speaker. One of the most enchanting parts of Nova Scotia. And that is the detour. If you have to take a detour in Nova Scotia, that's the detour to take. And the various tourist operations that are in that section of the province will benefit from the short period of time that they've got to take that detour, Mr. Speaker. Thank you.
The honourable member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Natural Resources. By allowing clear-cutting to continue unchecked, this government is blocking the development of good green jobs. The way the minister brushes off clear-cutting concerns doesn't suggest that she takes this seriously. Recently, the Healthy Forest Coalition shared a photo of a 2017 clear-cut on Crown land near Oak Lake. It was a hardwood hill with a lot of sugar maple. There's a nearby maple syrup producer who would have leased that land for syrup production, but that won't be possible now for at least another 40 years. Could the minister tell us that alternative uses of that forest land was considered before the clear-cut approval was given?
Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member for that question. Certainly, we have had applications come to the department about forestry measures where there have been hardwoods and there have been agreements made about sugar maple productions. So certainly, if anything had come forward to that department about that piece of land or any other lot, we would be looking at that alternative.
The honourable member for Halifax Needham.
Mr. Speaker, community forests like the Medway Community Forest are inspiring, and to use one of the Liberal Party's favourite terms, innovative examples of what Nova Scotians want to see for the future of our forests. They deserve and need more support from the province, and the market for carbon offsets presents a great opportunity. Sustainably managed, healthy forests can sequester many tons of polluters' carbon. More community-owned community forests on Crown land would inject considerable revenue from carbon offset sales into rural economies and create good green jobs. And I'll table an article related to that. So my question for the minister is, what is she doing to facilitate access to Crown lands for more community-run forests?
The Honourable Minister of Natural Resources.
Thank you, Mr. Speaker, and thank the honourable member again for that question. It gives me the opportunity to talk about the community forest, the Medway Community Forest, and the great job that they are doing and what a great asset they are to our province. Certainly, we are looking at all kinds of alternatives for Crown land. Actually, just recently, I've been speaking with the Minister of Agriculture about different projects that we can actually work with agriculture on orphan pieces of Crown land. So we're looking at all kinds of opportunities to make sure that our Crown land resource in this province is used to the best ability for all of Nova Scotians, Mr. Speaker.
The honourable member for Pictou Centre.
Mr. Speaker, the second question by the member from Victoria the Lakes, he mentioned about a GPS. Perhaps a member from Muscadaba, Colchester Muscadaba could use a GPS travelling through Stewiacke. Anyway, Mr. Speaker, the Minister of Community Services said many times that all Nova Scotians should have the opportunity to succeed and thrive right here at home, and I couldn't agree with her more. However, her words ring hollow and lack the action that thousands of Nova Scotians who receive income assistance deserve. Previously, I asked the Minister if she believes that the current funding of $223 for a rooming house and $535 for an entire apartment provided to those on income assistance in areas like Pictou Centre are adequate. It is the Minister's mandate to help Nova Scotians meet their basic needs. My question to the Minister, will the Minister provide the members of this House with a definite answer when her department is going to raise the rates for IA recipients so that they can live with the dignity they deserve?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. As the member knows, we are in fact in the process of transforming how we deliver income assistance to those that we serve, and there are a number of initiatives that we're rolling out right now. But I would like to remind the honourable member that over the last couple of years we have reduced the social housing wait list by 25%. After this budget that we are now currently debating is passed, Mr. Speaker, we will roll out a further $3 million investment this year, and that is the first of 3 subsequent years where we will see increases in the money for those supplements increased by $3 million a year. Thank you.
The honourable member for Pictou Centre.
Mr. Speaker, on March the 9th, I used the example of a constituent who did receive $535 living in a rooming house that was grandfathered in when the Minister's department made changes to their current funding model. Unfortunately, he had to move because of a bed bugs infestation. A constituent found a room for $435, but now he's been reduced to $223 because this accommodation had not been grandfathered under the new formula. Since then, he has to move into his elderly grandmother's one-bedroom apartment and has to use her couch as a bed. He has a mental illness that hinders his ability to find employment. He doesn't have any children, so the programs the Minister referenced last week would be of no use to him. The poverty reduction credit of an extra $20 per month is peanuts compared to what is needed. Question to the Minister, does the Minister believe someone should have to choose between bed bugs or $300?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question, and I would want to let him know that under the standard household rate changes, all of our income assistance recipients will move to the top of the maximum allowable for their particular for housing, so that someone who was in fact receiving a lower amount will move to the top of the range, and on top of that they will get either a 2 or a 5% increase on top of that. Thank you.
The honourable member for Cumberland North.
Thank you, Mr. Speaker. And in lieu of our Minister of Labour not being here, I'll direct my question to the Minister of Business. There are many Nova Scotians who, for various reasons, are not able to complete traditional formal grade 12 education. Without a skill set to enter the workforce, too many Nova Scotians are living in poverty. Barriers such as inadequate housing, lack of transportation, get in the way of getting an adult education and a skill set. My question to the Minister is, will he explore ways of working with the Minister of Department of Community Services and the Minister of Labour to assist in removing some of these barriers that people have in entering the workforce?
Just want to remind the honourable member it's outside of the rules of the House to indicate who is present and who is not present. So just keep that in mind. The Honourable Minister of Business.
Thank you, Mr. Speaker, and I thank the member for the question. Certainly the answer is absolutely. My colleague in Cabinet from Labour and Advanced Education, Community Services, and our entire government are certainly committed to providing opportunities for all Nova Scotians. And again, as I said to the member yesterday in response to a question, and as well as what's been really something that we're very proud of on this side of the House, and that is our fiscal record, because we can set the tone for businesses in the private sector to hire more Nova Scotians and make sure that we use programs under the Department of Labour and Advanced Education to match needs for employers and employees, and we want to make sure that we give access and every opportunity for Nova Scotians to work and make sure they stay in the workforce for a very long time. Thanks.
The Honourable Member for Cumberland North.
Well, that sounds really good, but it doesn't match the real world here in Nova Scotia and what people are experiencing. There are many businesses throughout this province that actually can't find skilled workers. This impacts a business's ability to have productivity. Trucking companies can't find drivers. Farmers can't find labourers. Manufacturing plants can't find skilled workers.
And we have people in our communities that are unable to find a job. My question to the Minister of Business is, will the Minister explore ways of working with the business community of Nova Scotia to create working internships and on-site training to bridge these workers so they can get back into the workforce?
The Honourable Minister of Community Services.
I want to thank the honourable member for the question. I would like to let her know that in fact DCS and LAE are currently working together so that we will be able to deliver programs, Mr. Speaker, at Nova Scotia Works Centres for clients from across the general population as well as the clients that DCS serves, Mr. Speaker. I would also want to let the honourable member know that each of the Nova Scotia Works Centres, Mr. Speaker, has a business consultant. They actually go out into their community and they find out what are the needs for those businesses there, because in the past we didn't have that, Mr. Speaker, and so often folks were going into centres and the very people that were delivering programs didn't know what the needs were in their communities. So we'll continue on with that, Mr. Speaker, and I want to assure the honourable member that we will coordinate among the 3 departments. Thank you.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is for the Minister of TIR. We see the Minister of Health smiling. Mr. Speaker, in rural Nova Scotia and many parts of Nova Scotia, the Department of Transportation Infrastructure Renewal is looked as an economic driver in the communities. One of the organizations that benefits from the work that is created by the Department of Transportation is the Nova Scotia Truckers Association. And when contracts are awarded, there is a policy / tradition of having a 20-80 rule where 80% of the trucks working on a project have to be from private small business owners. And I'd just like to clarify with the Minister if that he stands by that policy and will see that policy continue as an economic driver for small communities.
The Honourable Minister of Transportation and Infrastructure Renewal.
Thank you very much, Mr. Speaker. And it's absolutely a fact that, particularly in rural Nova Scotia, we depend on the investment by small owners who have a truck or two that provide some income for themselves, some jobs for people by attaching themselves to projects that occur, paving projects, other road projects, currently with the expansion of gravel road program in their area. And the 80-20 rule does currently exist, and there's nothing on the horizon that would see that changing. Thank you.
The honourable member for Sydney River Myra Lewisburg.
Well, thank you very much, Mr. Speaker, and I want to thank the Minister for that answer because it's a very important issue for many of those who are involved with the Nova Scotia Truckers Association. The other challenge for those members are the rates that are being paid, and over the last number of years, the rate increases have not been coming. There has been a 2% increase this year, and we appreciate that. But again, as a small business owner who has a limited season for making money, I'm just wondering if the Minister would take time to consider upping that amount that is paid to the Truckers Association so that indeed we can keep these people working in rural Nova Scotia.
The Honourable Minister of Transportation.
Thank you very much, Mr. Speaker, and I would like to highlight that the department has an excellent relationship with TANS, the Trucking Association of Nova Scotia. We correspond with them and meet with them regularly and have a great free flow of information. When it comes to the free market, Mr. Speaker, aside from what the Minister or the member has indicated with regard to the rates, it would not be seen as our place to interfere in that free market situation that exists. Mr. Speaker, thank you.
The honourable member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Mr. Speaker, I have met with women's organizations across the province, and they've all told me that the demand for supports for survivors of sexual violence is growing in Nova Scotia, and they're struggling to meet the needs. While I'm pleased to see that the government will continue to fund some beyond March 31st, including 3 sexual assault centres on the mainland and one that supports male victims, I'm not sure why the women of Cape Breton are being treated treated differently. And so, as the executive director of the Cape Breton Transition House says, it's shocking to hear that we were left out completely. So can the Minister of the Status of Women please explain why they were left out, why the services were felt that they were not needed in Cape Breton, and could she please look into this and try and find the funding that is needed?
Responsible for the status of women.
I want to thank the honourable member for the question, and I share her passion for the safety of women here in Nova Scotia. I want to let her know that in order to receive what were always billed as time-limited funds, organizations in fact had to indicate how they were going to continue those services beyond that point if they wanted. That's how they got that grant awarded, Mr. Speaker. We actually tried to remove costs from them so that they could use money that they would normally spend on other things to do that, Mr. Speaker, but absolutely, I will take this up with my colleague at Health. Thank you.
Order, please. The time allotted for confessions today has now expired.